The subcommittee will come to order. And I want to wish everybody a good afternoon and thank you for being here, especially to our very distinguished witnesses. 2 years ago, our subcommittee held a hearing on U.S. Africa programs and found that the unitary water budgets line item had been zeroed out. Needless to say, some of the members of our subcommittee, including myself, were at first astonished that such an important segment of our foreign policy was seemingly being abandoned, and we know that's not the case. We were assured that the money for international water programs did not disappear, but were merely redistributed among several programs. Today's hearing is intended to look at how effective that strategy has been and look how our government's international water programs can be implemented in the future and how we can be of additional assistance in the Congress in ensuring that that is done. Water is undeniably important to health and the very survival of human beings. Water comprises more than 2/3 of the human body weight, and without water, we would die in a matter of days. The human brain is 95% water, blood is 82%, and lungs 90%. A mere 2% drop in our body's water level can trigger signs of dehydration, including fuzzy short-term memory, trouble with basic math, and difficulty focusing on smaller print, such as a computer screen. Water is important to the mechanics of the human body. The body cannot work without it, just as a car can't work without gas and oil. It is therefore troubling that so many people in the world do not have ready access to clean water. According to the 2012 report released by the World Health Organization and the United Nations Children's Fund, roughly 780 million people around the world lack access to clean drinking water, and an estimated 2.5 billion, roughly 40% of the population, are without access to safe sanitation facilities. Tainted water and unitary practices are at the root of many health problems in the developing world and are hindering U.S. and international global health efforts. I know for a fact, and it's still one of the correctable problems in the world, that one of the leading killers of children remains to be diarrheal disease, traced back to waterborne disease. In my second term, back in the early 1980s, I actually authored the reauthorization and expansion from $25 to $50 million of what was known as the Child Survival Fund, and one of the 4 pillars of that fund at the time was oral rehydration salts to help those children who were dying a needless death attributable to the diarrheal disease. In the June 27th hearing on neglected diseases, our subcommittee heard testimony on the WHO list of 17 neglected tropical diseases, 3 of which are primarily waterborne. However, there are dozens of other diseases transmitted through contaminated water, including botulism, cholera, dysentery, hepatitis A, polio, and SARS. WHO estimates that more than 14,000 people die daily from waterborne illnesses, which cause more than 1 billion cases of intestinal worms, 1.4 million child diarrheal deaths, and 500,000 deaths from malaria. Moreover, water is at the root of international conflict. A growing number of conflicts are exacerbated by limited access to water. Increasing demand and greater variability in rainfall can inflame tensions, such as the concern Egypt has expressed about the impact of the Nile's flow to Ethiopia's proposed Grand Renaissance Dam. Although water circulates, returning to availability through various natural processes such as evaporation, clouds, and rain, only about 2.5% of the planet's water is fresh rather than salty, and less than half of the amount is available in rivers, lakes, or underground aquifers. Pollution consumes some of the available water from industrial or agricultural runoff. An estimated 40% of U.S. rivers and 40% of U.S. lakes are considered unfit for fishing, swimming, or drinking. We are in a developed country with significant resources. Developing countries too often don't keep adequate track to the extent of pollution, nor the ability to adequately do something about it. Other constraints on the global supply of water include efforts to privatize water systems in the developing world and the encroachment of salt water into freshwater systems. The challenge is to ensuring that clean water is available to people in developing countries are serious. That is why new legislation is being developed, the Senator Paul Simon Water for the World Act of 2013, and I do hope Mr. Blumenauer will, he's already joined us from out there on the panel, and this will strengthen the 2000 Act. The new bill calls on USAID to continue to observe the Water for the Poor Act of '05 in implementation of its water and development strategy. The bill would elevate the positions of our first two witnesses today, the U.S. Global Water Coordinator and State Department Special Advisor for Water Resources, to report directly to the Administrator of USAID and Secretary of State, respectively. Among other provisions, the bill requires local consultation on water management and usage and encourages local contracting and water sanitation and hygiene projects. I am glad to be a co-sponsor of this legislation because water is life, and we must be as efficient as possible in our efforts to provide clean water to those in need worldwide. In addition to the leading administration officials on international water programs,
you laid out the case, I think, in a compelling way. Um, the vast majority of the world's water is salt water. Most of the 2.5% that's left is locked, at least for the time being, until global warming does otherwise, in the Iceland, the Arctic, and the Antarctic. And when you factor out the water that's used for industry, for agriculture, basically it's 0.1% of all of this water that's available for people to drink. I cannot say enough about your choice of witnesses. It's been my privilege to work with them in the formulation of this legislation, with Dr. Holmes, with Mr. Holmes, Dr. Salzberg. You've got people who are on point, who've helped us get to this point. I love the release of the USAID Water and Development Strategy in May, and the broad bipartisan support, the people that were there and the NGO community. The second panel with Malcolm Morris, John Oldfield, the NGO community has been particularly focused, helping us understand and carrying this message out around the world. The last time I was sitting behind the dais with Malcolm on the other side of the witness table, before this very committee, was just a few months before Congress passed and the President Bush signed into law the Water for the Poor Act. I hope today, with your help and leadership, Mr. Chairman, and the advocacy and insight of the people that are here, we're going to be able to repeat that success with the Water for the World Act. And I must say how much I appreciate working with my friend and colleague Ted Poe, who has a real passion for this. It is an opportunity for us to prove that politics stops with water. We used to say it stopped at the water's edge, but here we ought to be able to show that politics does stop with water. Our colleagues Nita Lowy and Kay Granger, in one of the most difficult budget environments imaginable with strained resources, have been able to produce legislation that actually keeps intact the gains that we have made. I am very pleased with the progress we've made, deeply appreciate your attention and focus on it, and with our friends
cooperation. Third, invest in infrastructure. As one of the world's largest bilateral donors in water and sanitation, the United States invests in infrastructure in developing countries to meet basic needs and to manage water resources. Fourth, science and technology. While there is no silver bullet, science and technology can make a huge impact. We're working to incentivize innovation and the development of new technologies that can achieve results at scale. Fifth, partnerships. We can't solve this problem alone. We work closely with a range of international partners and more than 20 U.S. government agencies and departments. Partnerships like the recently launched U.S. Water Partnership can tap into the much-needed knowledge and experience and resources from the public, private, not-for-profit partners from across the United States and bring these resources to bear on these international challenges. As the result of U.S. engagement on water and sanitation, we've seen real changes. Since 2006, more than 34 million people worldwide have gained access to improved drinking water supplies, and more than 16 million. In fiscal year 2012, nearly 3/4 of all U.S. support for water went towards drinking water sanitation and improving hygiene, and nearly 30% of that support went to countries in sub-Saharan Africa. This trend has been further reinforced by the recent launch of USAID's first ever water and development strategy, which makes reducing water-related disease a strategic priority for the agency. The United States has also played a key role in shaping the way in which the international community approaches water and sanitation challenges. We've been the driving force behind expanding approaches to treating and safely storing water at the household level, developing water quality guidelines, and strengthening institutions like the African Ministers' Council on Water. In recent years, the Department of State has become increasingly engaged in promoting cooperation over shared water resources. These are not easy problems to solve. Transboundary water issues are often viewed through a national security lens. They're embedded within a much broader set of economic, social, and geopolitical issues. In some cases, water, rivers, lakes, ecosystems are closely tied to a sense of national identity, and development of these resources is seen as a sovereign right. Responding to these challenges requires patience, flexibility, and closely coordinated diplomatic and development efforts. With this in mind, we launched the Shared Waters Partnership in 2010. This partnership serves as a multi-donor platform that supports political dialogue in regions where water is or may become a source of tension or conflict. And we've used this mechanism to support regional discussions on the Nile, Niger, Okavango, many other regions throughout the world. These are just a few examples of what the United States is doing and how we believe that U.S. leadership on water is making a measurable difference in lives throughout the world. Mr. Chairman, thank you again for this opportunity to testify. We look forward to continuing our work with the members of this subcommittee, USAID, other U.S. government agencies, and other stakeholders here in the room to improve water resources management and to provide safe water and basic sanitation to those currently without. Thank you, Mr. Chairman.
Mr. Holmes, please proceed.
World Act, which obviously is just coming out, but as it's been developed, it calls for many of the things that we've already started to move out on, listening carefully to our colleagues. For example, the Water for the World Act calls for organizational shifts in aid to elevate the water team into an office, and we've done that. It calls for an elevated leadership position for water, which is the Global Water Coordinator position, and we've done that. It calls for metrics, and we've done that. It calls for really advanced monitoring and evaluation, and we made a commitment in the strategy for the first time to really start concentrating far more heavily on what happens after the cycle, the 5-year cycle of the program of funding closes, and we're going to do that. So geographically, I've given you kind of a thumbnail mention about where we are moving forward in terms of Africa. As we move ahead financially, we concentrate, and you're interested in the accounts, and I'm prepared to discuss that when you wish, really on 4 areas. Through our WASH funding and funds which are provided us through the directed appropriations pursuant to the Water for the Poor Act, and that's 100% devoted to WASH. And at the same time, we also fund our water programs through our water resources management programs, our water productivity programs, like support food production, and our international disaster assistance programs. And I think the good news is that while the directed appropriation has been at the level of about $315 million, which we have met, we have also exceeded that for the WASH funding by linking, our WASH programs and other ongoing programs in the agency. So to that end, when we have HIV/AIDS programs, well, it doesn't make a lot of sense to be giving people medicine if they lose the medicines through diarrhea. And that's where WASH makes such an important contribution. If we have nutrition programs, it doesn't make a lot of sense to have nutrition programs if you lose your nutrients because of diarrhea. So we make that coupling. So this is a quick kind of a tour de force overview, and I look forward to your questions. Thank you.
Thank you very much, Mr. Holmes. Let me begin the questioning, and I'll go back to some second questions to give an opportunity for all of my, and we'll have a second round if others would like it. But let me just begin, first of all, with, the Safe Drinking Water Act of 1974, as you know, the landmark law that ensures that Americans and anybody living in the U.S. has access to safer water. It affects 160,000 public water systems in the U.S. It sets national health standards for drinking water. And I was in Congress in 1996 when we increased in that capability. That law was expanded to include source water protection, operator training. And today there are more than 90 EPA has about 90 lists of contaminants on their maximum containment levels, or MCLs, including microorganisms, disinfectants, inorganic chemicals, including copper, cadmium, arsenic, lead, mercury, organic chemicals, including benzene, carbon tetrachloride, dioxin, and radionuclides. My question would be, the United States, more than Europe, I believe more than any other nation on earth, has written the book on how to, and we're still not there, it's always a work in progress, more things ought to be on that list of 90 plus, but we've written the book on how to make our water safer, and I'm wondering how you interface with EPA and how you take the lessons learned and hopefully pass it like a baton and mentor, frankly, some of those who have emerging systems.
So I worked at EPA as the deputy for enforcement there, and dealt a lot with the Safe Drinking Water Act and the Clean Water Act, which of course one could talk about for a long, long time. An important element of our work, particularly as it relates to this category of water resources management, is to really help build up the appropriate governance and policy and regulatory structure in countries. But at the same time, we really recognize that utilities, just as they play here in the United States, really play a really critical role in economic development, and particularly in Africa. And we have a major program underway throughout Africa to concentrate on the strengthening of utilities, not just from the perspective of strengthening, the manpower and staffing, but also improving their capacity to be able to pay for themselves to the extent the utility can, and also strengthen up their technical capacity to recover losses from water. And those losses tend to come from two places. They tend to come from either improper engineering, bad piping, some sort of technical flaw, or they come from, water being stolen and then being sold off on the side. So it's a really important question you ask, and I think as we go farther and farther ahead with our programs, this kind of work is going to become very important.
Especially as Africa industrializes and more of these chemicals leach into the
Yes,
aquifers.
and becomes more urban.
Yes, Dr. Salzberg.
Yeah, I'll be honest, I think the question we get most often, the secretary, whenever they're talking about water, isn't about give us your money, it's tell us how you solve this problem. More than anything else, I think developing countries are craving the knowledge and expertise of the United States from the governmental agencies, the non-governmental sector, the private. I think they understand that we have a very decentralized network of water supply systems here in the United States, of wastewater treatment here in the United States. They want to know how we make that work from a regulatory perspective, from a policy perspective, from a technical perspective, from a financial perspective. They want to see all that. We have an interagency team which we chair. We meet once a month, which includes representatives from all the U.S. agencies that work on water, departments that you probably didn't think did much work on water. NASA, for example, is a very active member of our group because some of the remote sensing tools that they bring to bear on some of these challenges. And that's really our brains. They're the folks who tell us what makes sense for us to do as we approach some of these policy issues internationally. Very, very important. We just launched the U.S. Water Partnership, which I mentioned. The idea behind that partnership is to address the exact challenge you mentioned, which is can we create a portal where we can bring the best and the brightest of the United States, not just from the governmental sector, but from the private sector and everywhere else, to bear on this challenge in a meaningful way for people from developing countries. That's the idea behind that partnership. We hope it succeeds and we can really take advantage of both the expertise that you have in your districts, but the expertise that we have here in the room.
If I could ask you, we will have a testimony from the Millennium Water Alliance, and faith-based, obviously, in all things that USAID does, I think plays a critical role. Do you try to be inclusive of those faith-based initiatives? And also, if I could, on unmet need, if you had more money, what could you do? The amount of money that you do have, how adequate is it? And then I'll go to Dr. Barrow.
So we work very closely with the faith-based organizations. I began working in the Office of Foreign Disaster Assistance with these organizations a long time ago, and we continue it. In fact, they were very active in the launch of our water strategy this year. And they're really just a strong ally. And one thing I've noticed, what we have in common with really all faith-based organizations, is that from my experience, their first goal is to save human life. And that's the first, that's the lead-off in this water strategy. So we're very much linked on that. In terms of more money, well, obviously, anybody from the administration is going to be very careful about indirectly asking for more money out of cycle.
I guess what's not being done should additional resources have been available, or what are we not achieving?
Well, I think that the magnitude of the problem is so huge when you're dealing with the numbers that you were talking about. 2 billion people without adequate sanitation on the planet, and 800 million of them still in need of adequate water. I don't want to dodge your question in the sense of saying we don't need more money. I mean, everyone obviously needs additional resources, but I think the real question here is how do you more effectively leverage what you've got? That's going to be the art form, I think, going ahead. And that is why we're placing a huge amount of emphasis on the kinds of partnerships we develop so as to be able to draw more capital into these aid projects. Because what's going on in foreign investment dwarfs what's going on in our aid program. So how do we basically link together? We have several projects that we're encouraged by. The Congress has given us a guarantee authority for loans, and we leverage that up to help build water treatment facilities, for example, in the Manila area, and we do it in such a fashion that we bring in Japanese financing to complement it. At the same time, we turn to big multinationals. Coca-Cola, for example, is the largest employer in Africa. So we have a partnership with Coca-Cola. It's a $30 million partnership. It's in about 10 countries. And we seek to develop projects in those countries which are sustainable. so that one way or another, over the long period of time, they'll stand on their own.
Yeah,
Thank you.
I think this conversation shouldn't be limited to our money. I mean, the fact is we need to see greater investment by the countries themselves, by communities themselves. We need to see full cost recovery of this service provision in the countries, the mobilization of local capital. There is liquidity in some of these countries. We need to get that money out and working for the communities. And so looking at some of the tools and mechanisms we can use to leverage some of that local capital, I think is going to be critically important.
Thank you. Dr. Burr.
Thank you, Chairman Smith. And again, let me compliment you on the series of hearings that we've had in this committee that really just focus on the basic necessities of human life: food security, water security. There's no greater need. And I look at this as a physician who's worked in public health. I mean, again, if you can't address, clean water, if you can't address basic nutrition, that there's not much more you can address after that. So it is just, you talked about an effective way of saving human life. It is also the most important thing that we can do to relieve human suffering. At my home institution, where I'm on faculty, the University of California, Davis, I've had the privilege, they have a long history of taking our medical students through various programs and going into Africa, going into Latin America. I've had the privilege of going with some of my medical students into Nicaragua. And when we go into the neighborhoods with the public health nurses there, it starts with just basic education as well, because you could see the food preparation facilities right here, and 5 feet away you see the sanitation facilities. So when we talk about foodborne illnesses, when we talk about it starts with that basic level of education, and there's a lot that we can do there. Certainly we have robust programs in the Peace Corps. We have volunteer programs. We have the faith-based initiatives that are out there. So pulling all this together so we're all working and moving in the same direction. Mr. Holmes, we have had the privilege of chatting with Dr. Shah from USAID and so forth, and also the Millennium Corporation. And we've emphasized this shift from just direct donation to capacity building in these communities, to helping these countries build their own capacity. And that obviously starts with education, but then it also starts with looking for local solutions where you're empowering communities and countries with solutions that are going to work there in those localities. We're just conserving electricity. Exactly. But then you can come up with small scale solutions that work for a particular house or a particular town, but we also then want to help develop scalable solutions. So, my first question to either one of you would be where you would go in terms of funding some of this research and development, but doing it in a mechanism that actually works in these developing nations.
So I think that you go right to the core of where we're trying to go. I can tell you've been talking to Dr. Shah. So let me answer it in two ways. One, very specifically, we developed the kinds of partnerships that are going to support really new, novel thinking. So we have a partnership with Gates called Wash for Life. We seek solicitations for ideas that are at a very early stage. We provide individuals with a small amount of money. So an organization called Sanergy received a $100,000 grant to develop in urban slums in Kenya ways in which to take human feces and convert it into a marketable commodity, sanitation marketing. And then we have a commitment that as this matures over time, we'll try to stay with them. And more recently, we've also made it probably the largest commitment from this fund to support the chlorination of water at the point of use, but in such a way that the chlorination holds in effect for a while after it's gone into the jerry can and come home. On scale, working with communities is what it's about, particularly when you're trying to end open defecation, because the relationship of open defecation to many chronic neglected tropical diseases, which are so troubling now that they're exceeding the capacity of antibiotics to treat them completely, and hence the importance of these preventative actions. So in Ethiopia, we've had a program heavily based upon community participation that successfully eliminated open defecation by 2.8 million people in the Amhara region. That's the kind of scale we have to get.
Please, Dr. Salzberg.
Yeah, I think we have to do a better job talking to a lot of these companies about how we look at local solutions and getting those into practice and working at scale. And there's some great innovators along those lines that exist. I think one of the important things that we can do from a U.S. government side could be along technology verification. We've seen this where CDC, Center for Disease Control, has done a lot of work to look at, as Chris was mentioning, some of these household approaches to disinfecting and safely storing water and proving the efficacy of these approaches in a developing country context, whether or not these things can work through a market-based approach to achieve results at scale. I think those are important roles that the expertise of the U.S. government might be able to help with.
Great. Well, again, I applaud you, and I should note it's great to see my friend Congressman Blumenauer sitting in this committee. Thank you.
Mr. Meadows?
Thank you, both of you. What I would love to hear from you is as you are, you mentioned the matrix that you're looking at from a standpoint of project specific, where they are, what we do. How do you think we can improve on that particular model, or is there anything from a legislative standpoint that we can help from a reporting standpoint or anything else that would give you additional tools to make those assessments on where to place the assets? We're all, we have a limited, as you mentioned, it's just a huge task. And so is there anything legislatively that we can do? And then from a matrix standpoint, how do you decide where we invest next?
Well, you kind of did it, because when you passed the Water for the Poor Act, you told us that you really had to develop criteria, and you had to make them public, and you had to engage the stakeholders in the process. So that was extremely helpful, and you can't get anywhere without a clear statement of objectives and plan, and quite candidly, until we developed the Water and Development Strategy, we didn't have that, and that impetus came from the Water for the Poor Act. I think where you can always be helpful is really in the understanding of the complexity of this problem. It just does not lend itself to easy fixes. And as we learn more about the sustainability side of this issue, namely it's one thing to say you've provided water and sanitation and hygiene, the acronym WASH, to people, and to say we've given these services to 10,000 people. It's another thing to try to figure out what happened to those 10,000 people over a 15-year period. And that seems to be the question that people really want answered more and more. That takes time, and it takes resources to do that internally.
I think we've got the push down. I think we need to see more pulling. And I think you can be very helpful in that regard. Your colleagues internationally, as parliamentarians, you have a very unique perspective within your own districts about how you deal with some of these challenges. Sharing some of those experiences with your colleagues internationally can do a lot in both raising awareness and the importance of these issues for them, and creating the kind of demand signals and co-investments that we need to see to ensure the sustainability of the work that we do on the ground. And so I think there's a large role that you can also play, not just on the side that you mentioned, but also on this idea of really helping create demand internationally.
So more on the international side of it, where we go out and stress not only the importance, but the dire consequences if we don't do this. Is that what you're saying?
Well, I think so, and I think you all come from districts that have personal experiences with this, so you have very appropriate personal stories on how this managed. And I don't just mean from a drinking water and sanitation perspective.
Right.
It's the relationship between energy and water,
Right.
food and water, all the other complications that you guys are dealing with.
Thank you, Mr. Chairman. I yield back.
Thank you very much. Mr. Weber?
I'm pretty sure. It's sad too.
I'm actually on a lot of
It's
gout
really
medicine
sad.
right now, and I think it's affected me.
I've known him for 20 years. That's the sad part. I thought we were friends. Mr. Chairman, do we need to go vote? That's the first vote's been called. So I'll. Yeah, and
My time is your time.
yeah,
Yes. Oh, sure, sure. And then we will come back then.
yeah, sure. Go ahead.
I mean, I
Have your
deeply,
bicycle, by the way, in my office.
I deeply appreciate your doing this. I just wanted to follow up on Congressman Meadows' point about the resource. I mean, these folks are being very diplomatic. But what we just heard here is despite the effort of the Focus, $2.5 billion that's been cobbled together from a variety of different areas, we've just moved the needle a little bit. And in some cases, like in the area of sanitation, we're at risk of falling behind because of rapid urbanization. But the key here, and part of what we're trying to do with the new legislation, is there are lots of ways to leverage money that's already being spent. Poor people around the world are paying a huge cost for poor water supply now that they buy privately or they pay with their time. If we can help with credit enhancement, a tiny shift of some of our aid dollars, we have an opportunity to help them get more out of their resources, save lives, and build friends for us. And we look forward to working with your committee, if possible, to just zero in on this with the legislation that's going forward, because it's coming to you.
I can also say on a first hand, I was in Brazzaville and I was drinking what I thought was bottled water, and I found out the locals recap it and seal it. And I found it out in a very personal way.
Yeah. Thank you. Thank you.
The subcommittee will resume its hearing, and I can't apologize enough for that length of voting, but so please accept my apology. Let me just ask a question with regards to the ratio of wells to public. You know, obviously it's a big issue here. How deep do they go? How clean, as opposed to a public water system? And if I'm not mistaken, the definition for a water system here is 15 or more people that are served. But what is the situation in like, say, sub-Saharan Africa with regards to water wells versus, you know, where are we putting our big emphasis to build out what kind of capability, or both?
Pardon me, Mr. Chairman. In some ways, some of the problems are analogous to what we're facing in different parts of the United States, namely rapid depletion of groundwater and the salinization of groundwater. So those become two extremely important considerations, and related to where you locate the wells and related to the sustainability of the wells are the programs we put in place on water catchment. And so we find that our water catchment efforts and our wells efforts are closely interrelated. And I think in some ways one of the iconic projects related to water catchments, which relates to water supply and wells, is the Productive Safety Net program in Ethiopia. And this is a project that I think you're going to hear more of in the future that dealt with anticipating major climatic change in Ethiopia, identifying a population of 7 million people that would be adversely affected by significant climate change, making a bet that it's going to occur, and then working with the population to put in adequate water catchment and adequate water supply, sanitation, and hygiene. So the issue of the location of the wells relates to the issue of basically ensuring that there's adequate water in the area in which you're going to be drilling. I guess the second part about the challenge of wells is to be artful in where you're putting the wells and the communities you're working with, so you're not inadvertently causing any conflict between agrarian and pastoralists related to the well sites. And again, in Africa, we're building up an increasing amount of expertise, working with the NGO community on how to appropriately site the wells. I think the third thing related to wells relates very closely to the issue of water and women. And we're finding that supporting community organizations that take ownership and a responsibility for the drilling and the operating of the wells becomes absolutely essential. And it becomes essential so as to minimize the amount of time that women take and the risks that they incur in search of water from wells that may not be in that good shape but are very distant and prevent tremendous danger to them. You know, in terms of a ratio of water wells to people, that's a tough one. I'm not quite sure I have a good answer for you on that, but I can look into it in more detail.
Okay. But what about in the public setting? I mean, the public water works, usually we define it 15 or more people are served by it, isn't that correct?
Well, there are going to be more people in 15 that are going to be having access to wells, whether it's urban or rural. I can assure you on that.
Can I just ask you, John Oldfeld, the CEO of WASH, who will be testifying, in his fourth recommendation, I just would love your feedback on it, and I'm sure he'll elaborate on it, but it says that we need to provide more effective oversight as to where and how these funds are being invested. We are concerned, he goes on, that many of these funds are not going to countries and communities where the need is the greatest for safe drinking water and sanitation. How do you respond to that?
So when we developed the water strategy, one of the big efforts was to develop the criteria that would relate to the countries that we would select for our water programs, and to do it on a priority basis. And the criteria which we laid out in the water strategy lays out two components. One component is need, and that would be things like childhood deaths due to diarrhea which of course relates to inadequately treated water. And the second criteria was opportunity, namely the ability of a country to actually manage public water systems effectively. And we weighted the criteria so it was strongly weighted towards need. And we plan to basically prioritize our countries around that criteria, which is heavily need-based, and then govern the allocation of our funds starting in FY14 as it relates to water supply, sanitation, and hygiene to meet those criteria. And that's a huge departure for us, Mr. Chairman.
Yes,
And I think if you look at the overall trends since the passage of the Senator Paul Simon Water for the Poor Act in 2005, I mean, you're seeing significant changes in our, you look at the DA accounts, and Chris, you can answer this a little bit better than I can, where I think when I joined in 2005, our first accounting in 2005, 2006, it was $16 million of DA in Africa for drinking water supply and sanitation, and that number is now well over, it's peaked at over 100 at some time. So you are seeing trends, I think, in the right direction. I think you're seeing the right prioritization of the Water for the Poor strategy. You're also in the USAID's Water and Development Strategy. And I think you're also seeing, when you look at the Millennium Challenge Corporation and the significant investments that they're now starting to make in many countries in Africa as well, this is a major contribution then to some of those challenges.
Thank you. I hope the other members get back, but just I guess I'm pretty much done. I want to thank you so much for your patience. I thought the other members would return.
Other way around. Thank you.
And again, I apologize for that delay. And look forward to work with you going forward.
We do too. Thank you, Mr.
both of
Chairman.
you gentlemen. Thank you. Welcome our second panel to the witness table. Beginning first with Mr. John Oldfeld, who leads the efforts of WASH advocates to increase awareness of the global WASH challenges and solutions, and to increase the amount and effectiveness of resources devoted to those solutions throughout the developing world. His previous experience with safe drinking water, sanitation, and hygiene comes from founding 2 implementing nonprofits in the sector, as well as his tenure as Executive Vice President with Water Advocates, a group dedicated to increasing financial and political support for worldwide access to safe, affordable, and sustainable supplies of drinking water and adequate sanitation. We will then hear from Mr. Malcolm Morris, who serves as Chairman of the Millennium Water Alliance, a group of American nonprofit organizations that he founded in response to a call from U.S. administration officials. Under his leadership, the Millennium Water Alliance is leading an effort to bring potable water and sanitation to 500 million people by 2015. He is Chairman Emeritus of Living Water International, which in 1990 began drilling water wells in Kenya for hospitals, schools, orphanages, churches, and communities, and is now operating in more than 20 countries, having completed projects providing water to more than 10 million people on a daily basis. And then we'll hear from Mr. Bui Raytut, who is Executive Director of Aqua Africa. He was born in a small village in South Sudan when he was 8 years old. His family fled to Ethiopia to escape the civil war in Sudan. His father was jailed in Ethiopia for political involvement, and after his father's release from prison, his family was granted political asylum in the U.S., and his family is settled in Nebraska. He co-founded Aqua Africa at the age of 21 and has served as a trustee for the South Sudan Community Association. Mr. Oldfeld, if you could begin.
Thank you, Chairman Smith, and distinguished members of the subcommittee for the opportunity to provide these remarks, which are a summary of my written statement submitted earlier. Let me express, first of all, my gratitude to the subcommittee for your support for safe drinking water, for sanitation, for health and related development challenges over the years. I'd also like to quickly applaud the efforts and commitment of my co-panelists here and frankly everybody in the room on behalf of this issue, and also acknowledge and thank the dozens of individuals who helped me crowdsource this testimony, Mr. Chairman. Imagine this, and you don't need to work hard to imagine this based on how this hearing has gone so far today. A woman spends the first 3 hours of her day wandering through treacherous terrain to find a 20-liter bucket of dirty, filthy water to spend the next 3 hours of that day hauling that dirty water back on her head, not knowing if that water is going to make her children sick when she gets it back home. She may not have even named her youngest children because so many people in that community died before the age of 5 because of unsafe water and inadequate sanitation. Neither she nor her children have a bathroom, so they suffer the indignity, the vulnerability, the physical vulnerability that the subcommittee members have discussed today through open defecation. Here in the U.S., we haven't lived under these conditions for a long time, but this is a challenge faced by hundreds of millions of people around the world every day. This is a grave challenge, but it is a solvable challenge. And most importantly, if I could leave you with one message, it's a challenge that's being solved in Africa, in Asia, and Latin America as we sit here at this hearing every day. The solutions, to get to some of your earlier questions, are often quite simple. These are wells. These are latrines. These are hand washing stations equipped with bars of soap. These are rainwater harvesting schemes. The most transformative of these solutions are those which focus on strengthening and building capacity of local communities to solve their own challenges. I'd like to just quickly highlight a couple of very recent successes in the global water sector and blend in my humble requests for the committee to consider. First of all, as you know, USAID has recently launched their first ever 5-year water and development strategy. We ask that your subcommittee continue to provide effective oversight as to where and as to how these funds are being invested. A couple of specific suggestions that you've really preempted with your early questioning, but urging USAID to continue to focus on the world's poorest communities and countries. And secondly, to leave behind not simply wells and latrines and hardware, but real capacity within the local communities to solve their own problems with our front-end catalytic support. Secondly, we ask that you support the Water for the World Act of 2013, H.R. 2901, as you know, which was introduced just this morning with very strong bipartisan support. Thank you for your sponsorship of that bill, Mr. Chairman. The point I want to make here is that communities don't get water, or they don't get sanitation, much less these health benefits and the education benefits and the poverty alleviation benefits, unless these projects function properly over the long run. Congressman Marino said to me this morning that we are taking care of our own when we do foreign assistance well. And I asked him if it would be appropriate to relay that message here, and he most certainly said yes. This bill, the Water for the World Act, is a pivotal next step in the direction of doing foreign assistance for water and health well. Thirdly, your colleague Congressman Stockman recently saw firsthand in his visit to the Democratic Republic of Congo how health challenges are restraining economic productivity in that country. I would ask you, and I think everybody in this room would echo this, personally visit, in your case visit again, developing countries and U.S.-funded water and sanitation projects. Nothing trumps that first-person experience there, and then you can tell a better story than anybody in this room can. And finally, we urge you to support, to work with your appropriations colleagues to support increased funding and, again, oversight for development assistance, specifically by supporting the $405 million FY14 Senate appropriations request for the Water for the Poor Act of 2005. Now, above and beyond what Capitol Hill is doing, my organization, WASH Advocates, is carefully tracking what Americans are doing in all 50 states for this issue, and probably all 435 congressional districts as well. Rotary clubs, churches, corporate and private foundations, ingenious social entrepreneurs, school kids, primary school kids, universities, and myriad nonprofits are all active, oftentimes in partnership with the U.S. government. And I'd like to quickly note Congressman Meadows' interest in public-private partnerships, and a number of these have been brought up so far today, and happy to provide more details on those. If successful, I believe that your and the subcommittee's actions will save and improve millions of additional lives by increasing the effectiveness of U.S. foreign assistance for water, health, and related development sectors. and at the end of the day, help these countries move toward aid independence. I believe that your efforts will catalyze more support from American citizens across this country for their complementary efforts. In conclusion, I would just add that things you already recognize, that this global water crisis isn't just a crisis. This isn't just wonky development talk here. This is a real, genuine leadership opportunity for this country that can help save and improve millions of lives around the world, and at the same time uniting Americans, as we're seeing here today with this aggressively bipartisan hearing, for which I commend you. These are uncertain times on Capitol Hill and far beyond, but the fact of the matter is, none of us spent the first 6 hours of our day hauling dirty water around on our heads. And none of us in this room are worried that our kids are going to die from an easily preventable waterborne diarrheal disease today as we sit here. I'd suggest that water-related death and disease have historically been unavoidable. And my colleagues and I at WASH Advocates and throughout this room very much hope to continue to work with you to make them unacceptable. Thank you, Mr. Chairman.
Well, thank you very much for your testimony and your concrete recommendations. This does help the subcommittee, and members will return and will read your recommendations as well as of our other two distinguished witnesses. So it really goes a long way. Thank you. And for your, obviously, what you're doing out in the field. Mr. Morris.
Mr. Chairman, Malcolm Morris, and I chair the Millennium Water Alliance. I want to thank you and your colleagues, your staff colleagues, for organizing this hearing today. From the testimony I've heard from the members of this committee, I think everybody is already in agreement in recognizing the greatness of this need and yet the constraints that need to be overcome. The Millennium Water Alliance represents 13 leading U.S.-based charities working to achieve safe water, sanitation, health, and hygiene, called WASH, for people in developing countries. Safe drinking water and sanitation are both life and death issues. They are also fundamental issues for women, public health, education, and economic and social development. Addressing WASH is the most effective step the U.S. can take to enhance its reputation among people in the developing world, and to work in partnership with our allies to accelerate the economic as well as political development that is foundational to true security in our world. Is it working? Yes. First, I want to point out our goal is not to complete the job of full water and sanitation coverage in any one country, but to build the local capacity within that country so that these nations finish the task for themselves. And more of those nations are moving in that direction. Among the many activities we conduct in partnership with the USAID are Millennium Water programs, where we train local organizations, you will hear from next, which are through WASH programming. Through our framework, local and national participants meet regularly to share best practices, lessons learned, and are held accountable by their peers to country standards, transparency, as well as technical effectiveness. How do we do all that? First, we meet with governments to determine standards for water quality, standards for water quantity. Country-specific technologies are established so that supplies, parts can be created. You have to have a supply chain. And then when you establish the types of implementations that are done, indigenous people can be trained in maintenance of water points. The last thing that we want to do is to create infrastructure dependent upon calling 1-800-USAID for repairs. Millennium Water programs use independent monitoring and evaluation by specialists to make sure that our progress is successful, up to standard, and is achieving desired goals. To do that, baseline studies regarding health and education are conducted and measurable milestones established to be able to determine improvements to the life in a community. These findings are shared among the participating organizations as well as government officials, which are invited to all of those meetings. USAID has an important role in priming the pump. Perhaps USAID's best practice has been in funding an RFA, which is called a request for assistance, in countries where the U.S. desires to put its best foot forward. Through successful deployment of initiatives funded with $11 million by USAID since 2009, MWA has been able to attract an additional $16 million on top of that $11 million of funding to facilitate even additional programming. Matching contributions have been generated from other donor countries, foundations, corporations, and even the countries in which the work is being undertaken. That's important. Science and technology are included in our training. Many lives are saved through oral rehydration techniques. I believe the chairman even mentioned that as we began this hearing. Through MWA and others, USAID has helped build momentum with pilot programs that can be replicated within the country. We enable community-funded maintenance programs which must be designed as permanent interventions. Community leaders must be included in planning and training to meet the water, sanitation, health, and hygiene needs for the future population growth of their communities. Wherever we have done water, those communities have attracted a growth in population, people moving there who haven't water where they're from. USAID should continue the use of RFAs to get underway quickly. It allows implementers such as the MWA to utilize their expertise responding to local factors that in the areas that are being served. Water committees are formed, which leads to more local empowerment. It's not really the provision of water in a community is not called Washington, not called the federal government, so to speak. Same way as at your own home. So these local committees are formed, which leads to more local empowerment, and especially among the women. And these committees create a learning experience where people elect their leaders to unlearn grassroots democracy. This is also fabulous in what USAID has led. USAID's support of the Millennium Water concept in implementing WASH programs within developing countries has achieved something, though, beyond the original plan. In partnership with American NGOs, USAID has become recognized for its leadership in WASH. I remember the day when I walked into USAID and they could not find water in their programming, in their computer systems, anywhere. I'm sure there was some, they just couldn't find it. Today, totally changed. We have a great team there. The policies been put out. And now, here's what we're seeing. Other countries, corporations, multilateral organizations are calling on the MWA because they've seen what the MWA USAID funded projects have done elsewhere. And they're saying, hey, would you come and apply your expertise in our country to assist us in water programming? These are places where USAID is not even being called on for a dollar's worth of assistance right now in this area. So because of what USAID has done to prime that pump, we're seeing this reputation build, and we hope to see that USAID may even consider the possibility of capacity building grants to even further these opportunities and low-cost opportunities. So included in my report, Mr. Chairman, is a study of an example of a great new water program in Kenya. It demonstrates the power of partnership between America's charities and USAID that leads to even larger partnerships with others around the globe. With funding from USAID, funding from a major Dutch organization, the Dutch government, as well as matching funds from Millennium Water Alliance members, a perfect example of a forward-looking collaboration has been built to build against community resilience to drought. So the Millennium Water Alliance and its members want to point out fully support the Paul Simon Water for the World Act, House Bill 2901, introduced today by Congressman Earl Blumenauer, Ted Poe, and Chairman Chris Smith, and I believe already 10 co-signers, if that's correct. This bill does not require additional budget, but improves the way USAID partners for achieving maximum efficiency. It puts it into the statute. We don't want to go back to the time when we couldn't find water. We want it in the statute where everybody stays focused on it, and we appreciate the committee recognizing the importance of that. We are eager to assist the committee, this subcommittee, in any way we can to advance the great work on behalf of the American people, and I'll be happy to take your questions. I have a write-up for you in my submission about the Calder project in Kenya, which really discusses how all the things that I just told you about are actually being deployed just within one program now.
Ms. Morris, I look forward to reading that, and you will convey it to us. And without objection, all of your testimonies and any attachments will be made a part of the record. And when you said you don't want USAID to be the repairman 1-800, I thought what we want these programs to be is like the Maytag repairman.
Yes.
Never gets called. Mr. Tutt.
Yes, sir.
Well, I would like to thank you, Chairman Smith, for this opportunity. Also, Congresswoman Bass, who's unfortunately not here, and also the member of the panel here. I feel fortunate enough to come share a little bit of my story. I think to explain what I do and how I do it, it's important to know where I'm from and why I came about this line of work. I am, like you mentioned in my autobiography, I am from South Sudan. I was born there, and my family was granted asylum in the United States. Actually, my father had a choice to pick between Canada and the United States. He said Canada sounds freezing cold, and moved us to Minnesota. So,
You got Minnesota.
but we've lived in Nebraska for right now what amounts to about 15 years. And when I was in college, a friend of mine, also a native South Sudanese, we wanted to go back to South Sudan, and we wanted to support our new country coming about. And when we talked about going back to South Sudan and really trying to help, we said, what do we want to do there? We really have to have a philosophy. Why are we going back? And we said, what we come down to is we wanted development over aid. We're looking to move back to South Sudan in 10, 15 years. We love the United States, but we're moving to go back. So how do we create a nation that's not sustaining? We no longer go by, we're a developing nation. What we are, South Sudan is an aspiring nation, and we think East Africa countries are aspiring nations. So what we've designed is a 3-step process. First, we drill water wells for about 500 people. And with Aqua Africa, what we do is we drill one water well for about 500 people. And just like Mr. Morris explained, our second portion is called micro-democracy. And for micro-democracy, what we do is, of the 500 people we drill for, we have the 500 people, we set out boxes, help them elect 6 members of committee to run the water well. And our objective in that is that people understand on a micro level rather than on a macro level why democracy is important, where it's going. And our objective is in 2015 or whenever we have following elections, is they understand and go vote. They understand the applications of voting and why democracy is important. And our last portion, what we teach, again, using water as an example. Water is the starting point. We teach resource management. Resource management, we teach the people that when we drill a water well, that pipe doesn't go to the Indian Ocean. That water will run out at some point. So you have to create policies in place in order to manage it effectively. Now, what inspired us to do this, and why I'm telling you all this, is because we are from South Sudan. I was born in East Africa. Jacob Cole was born in East Africa. Boy Weewal was in East Africa. What's unique about this point in history, we feel, in East Africa is no longer are we just willing to help East Africa, willing to help where we were born, is we're able to. I've been here in the United States for 15 years. I've gotten a tremendous education in the United States, and the people have been there's been a tremendous amount of capacity building. now I'm ready to go back to South Sudan. And I think what we're missing right now in a lot of these discussion is, why don't we have an East African or anywhere we're helping inspiring nations from the beginning process to the end process, from the design phase, implementation phase, and execution phase. And when we're looking at it, what we wanted to accomplish at this point with foreign aid and everything that's going on is, we want Africans that are from there, that have experienced it. I was fortunate enough, I was unfortunate not to have a sister, so I had to drag water back and forth with my mom. So, but what we were trying to accomplish is, we're trying to get Africans, I mean, wanting to go back and help, are able to go back and help, and have the capacity to help. And the thing that's changing is, that's us. I mean, when you look right now, I'm half curly hair, dark skin, as my mom would attest, attractive feature. But I mean, on what we're saying at this point is, we're ready to go help. And concentrating on water policies looking forward, I think it's not just important, it's critical to have us on the table, to have us see what we're gonna be doing, because that inspires ownership, and that inspires us to take it on fully. So, and again, I'd like to thank the subcommittee for inviting me to be able to share my story, and I'll open it up to any questions.
Mr. Tutt? I appreciate that very much. I wonder if you or any of our panelists are aware of a capacity that might exist in this country that is being shared with regards to universities, training people in water management, or at least courses that can be learned online. Is that readily available so that someone, say in Kenya or South Sudan, who might have access to a computer or could get to a college here or somewhere else? I mean, is that something, are we trying to build up that intellectual capability that then can be applied to all of, that can implement these strategies?
I might address that through Living Water International, which we founded, has put chapters basically on college campuses, and the through student demands, Student Engineers Without Borders, et cetera, have worked their way into engineering programs, and the students are actually being trained to go to other countries. I had the opportunity to work with Oklahoma in establishing the OU Water Center, which now awards the first ever United States World Water Prize. And it's headed by Dr. David Sabatini. Every 2 years, there is a meeting there. People are brought in from different countries. We raise funds, if you will, for those to come to the conferences and learn from what the universities are doing. They're doing major work in some of the issues that we face with contaminated water that we find. So it's fabulous. Gary behind me here with water.org is University of North Carolina. They have a fabulous program in water. So a number of universities, Southern Methodist University is picked up on it. Emory University is picked up on it.
How long of a study does it really entail in order for someone to become at least proficient in putting together a clean water?
Well, when you say these are people getting, if you look at some of the young people USAID is hiring, they're getting engineering degrees in hydrology and et cetera. So these are full 4-year degrees.
Well, my degree is actually in political science, graduating from University of Nebraska. When we began Aqua Africa, in our 3 years of operation now, we've served 4,500 people. We've drilled 9 wells in South Sudan. And I didn't get that through getting my engineering degree. A lot of, I think, the information we need is readily accessible. I think the most important thing is identifying in which area that we're going to be working in, first of all, and then identifying those needs. And once the need is there, the resources to facilitate that, I think are readily available as long as we're able to access it, and I think it's there.
Great. Well, Mr. Chairman, if I might add my 2 cents to that. You've asked a question that our intelligence community is concerned about as well. Last year, 2012, there was a national intelligence estimate on global water security, which, as you know, suggested that global water challenges are likely to pose security threats to this country over the next decade. The one key finding that's interesting and in line with your question is that the intelligence community found that Americans are expected to lead on this issue. We know how to solve these problems, and Americans in the both public and the private capacity are expected to lead. I'm going to do a little more homework on your question and figure out exactly what this country is doing in its private capacity. I am more familiar with what a couple of multilateral organizations are doing on that. What I'd suggest is that, what I'd like to highlight is what USAID in particular was already doing to share not just best practices that they're finding in their programming with many of the organizations in this room, but come together and share emerging practices, or dare I say worst practices, not just in water and sanitation and health programming, but in programming across a development portfolio. Our government is making strides in that direction. And eventually, I would hope, and it may already be happening, that information is going to get out into developing countries in Africa, Asia, and Latin America, fully cognizant that online education is tricky and that no one solution is the same from one community to the next, as you've heard here today.
How realistic is it that there will be a real growth in the area of large water treatment systems, as well as for dealing with sanitation? The cities, are they more likely to be the places where that's going to emerge sooner rather than later? And I asked this earlier of our earlier panel, and I would ask it of you as well. The lessons learned from the Clean Water Act, the Clean Drinking Water Act, or Safe Drinking Water Act, I should say, and all of those contaminants that we now look for, and I think, frankly, in my opinion, there's still a whole lot more we need to be looking at. But there are at least 90. There's over 90. How specific do they get in looking for those kinds of toxins and other contaminants that are contained? Do they have that capability in some places but not in others? Does South Africa have it? But it's not as likely to be, obviously, in South Sudan as it emerges from all the problems of war and
most everywhere I have been, the government does have government testing labs, and they part of the oversight of the government is doing water quality testing. Some communities who get well-to-do enough buy their own equipment for testing. Clearly, we probably have more contaminants in this country than people experience in the developing world, because we've put in manufacturing runoff, et cetera.
Right,
and all of the pills that get flushed down toilets in America, et cetera. So it's a bigger problem here, but it's something that from here we need to recognize that it will happen there. There are some remote sensing and testing technology now that can actually be inserted in pipelines to test the water. So it's kind of like the pigs that they run through the pipelines to make sure there's no leak, the oil pipelines with no leaks. So there are remote sensing that can be done, and cities are using that because it's really a terrorism issue as well.
I find when I travel throughout Africa, and I find this in many parts of Europe. I was just in Istanbul and was admonished not to drink bottled water. I remember being in Leningrad when it was Leningrad in the early 80s, and it hasn't changed now that it's St. Petersburg, that you're admonished again or asked not to drink the water, to be very careful. I'm wondering, how are they looking for enough of the contaminants? I mean, is there like a register that you, when you're talking to them, you need to be looking for this or looking for that? And if you, in answering that, a few weeks ago we had a hearing on the ever-present and seemingly worsening problem of tropical diseases, particularly those that are neglected. And there was particular emphasis played on deworming and the fact that we're doing some very good things on deworming, but it is such a huge universe of hurt that we're not doing enough. About 1 billion people, the estimates are, have worms. And some of the takeaways from the hearing was that there's It makes women more susceptible to HIV/AIDS. It leads to anemic children, low birth weight children. And I, on that trip to Istanbul, was with a doctor who served in Ghana, and he said that he had this experience where a woman brought her son in because his urine was clear, and she thought he was sick because all the other kids' urine was red or pinkish, from the worms. And I'm just wondering, if we really fully understand that clean water that doesn't have worms and other kind of parasites inhabiting it will lead to a lot of benefits on those issues as well. I mean, waterborne worms are a problem.
I've walked into a community using hand-dug wells and dropped a bucket down, lifted that bucket up, put my hand in the bucket, and counted the worms in my hand. And this was the water that the people were using. And water that is hand-dug, basically you're only digging down to the very first underground river. And that is often what we call latrine water, or refer to as latrine water. That's where the contaminants will go and disperse. And so we will drill through and case through that type of thing. When we're putting in water, we're putting in sealed wells, sealed systems.
How deep do you have to go?
More than 20 feet, just more than 20 feet, because the earth acts as a natural filter. But in the drilling process, you contaminate the aquifer, and so you've got to cleanse the aquifer. And when you're cleansing it, you're chlorinating and so forth. That sometimes the odor becomes offensive until that cleaning process takes place. But I think you're talking about maybe more in the urban areas, and where cities are growing, as we were just talking about earlier. And in the cities, the main problem that we're seeing is that there is overuse of the water. If you're the mayor of Addis Ababa, you've got 10,000 people moving into your city a day. There's no place for them to live. They're open defecation. They're going in the rivers. They're polluting everything around. And you don't have enough water to deliver. So what happens is the old city water pipes that were built for a city of a certain size, there's not enough water to push through them. And so when the water is not, if the pipes are not pressurized, then you get contaminants seeping back in the pipes. And then you get some bad water in the cities, which is probably the kind that Congressman Stockman partook of. So that's...
Remember for you.
So,
Will the gentleman yield just briefly?
And then
Well, he's not telling you, also during that hearing, we had specialists actually come up from Houston, and a lot of the tropical diseases, and you'd be interested in this, Malcolm, were in Houston. And I was shocked to hear that there's a reintroduction of tropical diseases in Houston. And during the hearing, he was covering a broad spectrum of different things that are occurring in our own city. In fairness, Mr. Chairman, I know the gentleman now for over, I guess, 30 years, 25 years. I knew his father, who was very active. And in a testimony to Malcolm, he could be doing anything he wants in the world. And I am thankful that you chose to save lives and to work in this area. You're doing a good job. Thank you. You could be on a yacht. Instead, you're giving your time to this cause, and I really appreciate it. As I said, we were delivering medicines to Africa, and the need is so great, and the people are so grateful to when you do that. So I really just want to acknowledge his efforts and what you've done, and really appreciate it. And I'm excited that we're going to do this. As always, your work is phenomenal, and appreciate it.
together. Thank you. Any questions or of the witness?
Well, no, one of the questions I
Yeah,
had,
this
I
is-
had more of an
oh,
interest
I
in
didn't know.
Africa, and you were saying 20 feet, but is that true? What part have you been in Africa? Where do you drill most of your wells? And I understand some people use the merry-go-round method to get water, where they use that, or what methods do you use?
well, the merry-go-round is really just a pump. That's once you've drilled your well. But wells in Kenya, you're a mile-high city, sitting on top of granite. We're putting in 1,100-foot wells. You know, in other places, India, you'll be putting in 120-foot wells. In Nicaragua, you'll go through a 20-foot, 50-foot, 80-foot, 120-foot aquifer. You'll find rivers at all those different levels.
But are you using the same technology they would if you were drilling for oil? Is that why? I mean, Houston has such
Yes.
a natural abundance.
It's the same process. You would use different size rigs depending on how deep you're going.
Do you have companies that step up and say, "Hey, we know you're involved in this. We want to help you," and offer their assistance at all?
Yes, and at Living Water, I know now that we have oil industry that are doing. They want to do something to return to the countries to benefit the countries where they're doing oil drilling. And one of the greatest benefits that they find being requested in those countries now is water. I would tell you that under the Foreign Corrupt Practices Act, you're not supposed to pay somebody off, so to speak, to get a drill contract. And it seems like that if they are asking you for something, somebody wants to give money to their brother-in-law. So they've come to Living Water and said, can we give you the funds and you go do the projects? We've been called on by the United States government to go in and do projects where they needed to, had committed to do certain water programming, just said, please program it for us.
What country have you drilled the most wells for water? Would you guess?
Wow, that would be, at Living Water, we've drilled about 14,000 now.
Wow.
And then at the Millennium Water Alliance, the 13 member organizations are now serving over 100 million people a day.
Wow, that's phenomenal. And I'm not being disrespectful. I just so. And are you deeply involved? No pun intended. With the
Deeply.
Well, thank you, Mr. Stockman. First of all, I'd like to second what you just said about Mr. Morris here. Big fan, and he could be doing anything he wants to. So well done, Mr. Morris. We are a nonprofit advocacy initiative, and we are, to answer your technology questions, we are for whatever the most appropriate solution is in any given part of the world, whether it's Africa, Asia, or Latin America. We look for technical appropriateness, technical sustainability. We look for environmental sustainability. We look for financial sustainability. We look for socio-cultural sustainability to make sure that a project in South Sudan is appropriate for the South Sudanese, that it will be maintained technically and in local hands with decentralized ownership, that the individuals who benefit from that will be able to support in financial terms its operations and maintenance, and to make sure that quite simply, if you're putting in, using chlorine to disinfect water, to make sure that people still use the water even though it tastes like chlorine, or to make sure that when you're purifying river water, that the local individuals in Guatemala or Vietnam aren't concerned about sociocultural things like anger in the river god. I mean, all of these are true stories. We are for pit latrines that are used for their intended purpose, to properly dispose of human waste, rather than to be used to store cow dung or bicycles, or in some cases to live in during the rainy season, because that might be the only physical structure in a village that holds up. So we're in an interesting spot as a neutral advocacy organization to be for only those solutions which are technically, financially, and socially appropriate in that environment.
You mentioned South Sudan. I was there in Juba, and I actually went on foot, which they told me was highly unusual. And one of the things they were showing me when I was there is that the North Sudan or whatever had taken and poisoned their wells and also poured concrete down them. And they, not just one well, a lot of wells. Are you from Juba?
I'm not from Juba. I'm not from Juba, but I am from South Sudan.
Oh, okay. Well,
Bernal State, North Sudan. Or
you have a
Bernal
beautiful
State.
country, beautiful people. I appreciate the hospitality you showed us.
Well, great. When were you there? I don't know.
A year ago, January.
Oh, okay.
And another thing I saw, which is tangent, if the chairman grant me a little bit of leeway here, is that sometime I think they need to see you play volleyball, because it's a combination of soccer and volleyball. It's the most amazing thing. But getting back to the wells, it was very upsetting to see the number of wells that could be used. I don't know, is there a way to rehabilitate a well that's been sabotaged like that?
Well, if I could take this one. honestly, when you're looking at a well that's been sabotaged in that manner, it's very difficult because I mean it's much more cost effective to build another one. Right now, when you're looking at South Sudan and the needs, and not just South Sudan but East Africa, in these drilling projects, so you have, I mean, advocacy groups, and then you have groups that are getting others together. What we need to do is build a capacity of organizations that are from there, working there, and honestly understand it. We drill about 50 meters into the ground. That's where we think it's the safest. I mean, you have salt content that goes high whenever you're drilling, and if the water is, I mean, it has a really high salt content, people don't want it, and that goes into the testing thing. The testing methods Chairman Smith brought up earlier. What kind of testing do we employ? We work with the local government to see what the standards are, and what the unique thing is. We remember what it was like when we were kids. I remember when I was 8 drinking the water, what I liked and didn't like. And I know what would prevent me from drinking it versus not. So when we work in these areas, we understand the people. I mean, they know us, they see us, and that's what makes us effective in the manner. And that's why it's very important for Mr. Oldfield and Mr. Morris in the areas they work in, building our capacity to be able to do what we're doing in those areas.
I was shocked at how many wells. I mean, they were showing me all the wells that were, you know.
Yeah, it's astonishing.
Yeah, it was
very
really
astonishing.
amazing. We also gave out 200 pounds of candy.
Hopefully took
We
good
created a
one.
new industry, dentistry, but
Well, just on one of the questions, I was thinking about, as John was speaking about the social issues and different things you face, fluoride is fixed by using some ground up bones. But if you go to one country, you don't want to use ground up pig bones, and you go to another country, you don't want to use ground up cow bones. So, I mean, it gets very, very detailed to be a part, as Mr. Tutt was just saying, of what is the local posture. You know, we don't put the same technology in every country. One country likes French equipment. One country likes another. It's okay, as long as the whole country is getting toward a standard, and then people can learn to maintain and do for themselves.
Just a couple of final questions, and then anything you want to add as we close. First of all, I do want to note that Christian Holmes, the Global Water Coordinator, has stayed. I've chaired maybe 450 hearings as a member of Congress, including Foreign Affairs Chairman, not Foreign Affairs, the Veterans Affairs Chairman. Usually the administration people leave and never listen to the panels that follow. So I thank you for doing that, for caring so much to hear what people, the NGOs and others have to say. That speaks so well of you. Thank you. I do have just we just had a rollout of an idea with a number of NGOs last week on the whole issue of electrification and the need for electrification in Africa. And I'm wondering how, you mentioned in your statement, Mr. Oldfield, that, to push the administration, one of your 5 points, harder on linking water and sanitation with other important development objectives whose success depends on safe water. Well, if you just drop who depends on, there are other developments. I mean, things work synergistically when you've got a larger strategy. How will electrification help? It seems to me, and you also make a point in your statement, I thought it was great, about visiting and, encouraging members of Congress and all of us to go see a water. I've done that many times, but one time I was actually at a refugee camp in Darfur when the water just came online while we were there. I don't know if they timed it, I don't think they did. And it was amazing how people were going,
Isn't that amazing?
were going, it was euphoric. And a lot of water was wasted in the process because it was being thrown around and dumped because people were just so happy to be able to turn that spigot. But I caught I was giddy too. So your point is very well taken there. But about this working side by side with other development goals, if you might want to expand upon that, especially with Mr.
Sure,
with
I
Christian
bet
stuff.
that our co-panelists will have lots to say on this as well. Let me just suggest one thing. It's an interesting question you asked about electrification. The soundbite is this. I mean, development is about a whole lot more than water, but it's never about less than water. So, I'm not here to say that anything is more important than anything else, but turn out the lights in here and see how it goes, or let's try to live for the next few days without safe drinking water. It really gets back to the primacy of water and basic public health to human existence. Specifically, to answer your question about electrification, that's part of the solution. Innovation, science and technology, research and development, you bet that's part of the solution. I've seen some UV systems that use less and less electricity as they narrow the spectrum down to more cost-effectively purify safe drinking water by irradiating it. There are a lot of great solutions. My concern about technical solutions in the water sector is simply that we don't want to go overboard on that. Desalination, of course, is part of the answer. But you know what? Instead of focusing on really high-tech desalination equipment in multi-billion-dollar installments, I'd suggest that most parts of the world need to take more advantage of the biggest desalinator out there, which is the sun. Let's desalinate water by evaporating it, and let's capture rainwater harvesting. We've all agreed here today that there's no silver bullet for this. I would suggest to you that simple rainwater harvesting techniques and a simple improved pit latrine may come as close to a silver bullet as anything we'd have. If I could answer your NTDs question as well, NTDs solving health challenges are about much more than water, but never about less. Once again, NTDs are complicated. They're neglected for a reason. Water clearly came out from Dr. Hotez and the others at your testimony there. Every single one of those people, including the doctor and the nurse on your subcommittee here, understand that water is medicine. That toilets are medicine, that hand washing with soap is medicine. We're not here to say, and I'm particularly not here to say that NTDs are not important and should continue to be neglected. Absolutely the opposite. Do everything you're doing to support that. Also include diarrheal disease as a neglected tropical disease, which it certainly is, and it's easier to pronounce than many of the others. And all of these are solvable by safe drinking water and sanitation.
Thank you.
Well, my grandmother she lives in northern part of Ethiopia in the mountains. My mother is Ethiopian. She called for the first time last year to see if I've been eating enough. And what this remarkable thing about it is, we never had phone towers. She didn't have a way to access electricity until an NGO came and gave them a charging system through solar charging. But to get back to your question, if this is something we could compile, so for Aqua Africa this year, we're building a water tank, and this water tank is going to have a capacity of 50,000 liters, 6 distribution points with 2 going, 1 clinic, 1 school, 4 areas of distribution. And in that, we're including a solar system to where people could charge and actually charge people money to be able to charge others. Compiling these developmental efforts advances it from just aid to development. I mean, and that's very important. To stay 3 more hours and to be able to study changes the people's lives. I wasn't able to read when I was a little kid. Now, if I had the opportunity, would I? I mean, I would have given it a shot, So it's to say that we could compile these things all together. I think it's an amazing way of delivering aid and making it development.
I want to just say a couple of quick things. In Guatemala, we try to meet the community's needs. You don't want to go in and do something to a community. You do it with a community. And so in interviewing the community, they may want the least costing intervention. They don't have electricity, et cetera. So that might be something like a hand pump. But when we're in Guatemala, we always want to deal with the local government and make them a part of it because they're going to inherit this ultimately. And so the mayor came. And so we had the mayor speak each day. The second day he came, speak again. I said, say, we drove under an electric line. I said, how far is that from here? And he said, well, it's only about a quarter of a mile as the crow flies. And I said, well, what would it take to get electricity to this community? I said, these people are already asking the boreholes here, going to put a hand pump on it, but we can pull this hand pump right off the top, and you can drop an electric pump down there. People can have distribution right to their homes. Well, other people kind of overheard that, so the mayor said, well, we could do that pretty quickly. He says, matter of fact, within 6 months, we'll have electricity. I mean, people went home, got shovels, they're digging to the well, put their pipes in already. And By the next day, he came and he was bringing people from to put in a health clinic in this community because this community's got water now, and he says, we're in the process of bringing electricity. There were only 3 days there, you know. So it was amazing to see. And in Malawi, we Living Water trained Water for Malawi. We went to an area west of the long way, about 60 minutes out, and began doing water programs there. I think we're serving a couple of million people there now. And the persons that we began that with were specialty in women and infant mortality. And so we've built a hospital there now. And we've just signed a partnership with Baylor Med, which in Mr. Stockman's hometown here. So it's now the Baylor Med Child Legacy Intervention. They have built in Malawi, out in the boondocks, a total hospital infrastructure, operating rooms, all this. It is the only medical facility in the country that we know of that has non-fail electricity. It's got solar, it's got wind, it's got battery storage, and it's got generator backup, and no hospital. So it's now becoming the center for the new residency program for all of Malawi, right out in the middle of nowhere. So electricity is extremely important, very important if you're in the middle of surgery to have electricity. And I don't know that there's a lot of synergy with water and with what we do, but we clearly make use of it when it becomes available.
I just have one final question, if Mr. Stockman has any additional. How well do you think, and please be absolutely candid, do you think we, the U.S. Congress, prioritizes clean water and proper sanitation? What about other European countries, the European Union, for example, and other donor nations? The philanthropic community, I mean, there are other things that you know, are seemingly less mundane, but perhaps not as important, that the philanthropic, with the Gates Foundation, others may rather put their dollars. I mean, are we all doing enough? It would seem like we're not, but you know, I asked this question earlier about the unmet need. You know, how big is that gap? And finally, a lot of, obviously, the leaders, when they're at the local level, like mayors, and it happens here too, many of us go from being mayor, councilman, assemblyman, to eventually being in Congress, and then indictment, no. But a lot of the people at the lower level
Not this group.
end up being presidents, end up being in their national parliaments, and I'm wondering if the lessons learned about the importance of clean water carries over so that they bring that vision to the nation.
You know,
You
I
find that
have
happens.
to say that if you look at anybody in the world, we've got an immigration debate going on now. Everybody in the world wants to come to America. I mean, I don't know anybody who's offered an opportunity to come to America and said, no, we don't want to go there. People want to come here, and when I began working on this at a more national level, and going to, you know, I spoke at the World Water Forum in Mexico. I've been around in global meetings, but I was surprised at the lack of leadership by America. I mean, that's why I went to USA. I said, what are we doing, you know? And the change that I have seen, I mean, we might all sit here and say, oh, we're not doing enough. But today, when you ask the world who's leading, it's not Japan anymore, it's the United States. USAID, established the water team, the great reputation, like I said, it's enhanced. They helped the MWA get started, and now even in places where they're not having to fund it, the MWA is being funded by other organizations. And Mr. Gates is very actively involved, and he's really focused on sanitation. Mr. Hilton, very actively involved. He's really focusing more on the water, so they kind of work hand in glove. And one thing we forgot to mention today, and that is soap. Mr. Gates funded a major study in Kenya, 5-year study. I think it was $9 million. And at the end of that $9 million, we talk about people coming to the cities building and so forth, and water does attract people. Well, when you bring more and more people together, you increase the chances of waterborne, contaminants and people gathering together in that place. And that's what happened. They provided soap for like the first 3 years of the study and then didn't provide money for soap. People quit using soap. Well, they'd come together, they learned to not openly defecate, everybody's coming to the same place, and actually disease went up. And so you have to have soap. So that $9 million study, soap. Very important. And
You
you
know, you
got to
mentioned
keep it
Hil-
on your hands for 20 seconds.
You mentioned Mr.
Chairman.
Hilton. He was asked on a TV show once what his best advice would be. He said, put the shower curtain inside the tub.
That's Baron Hilton. Conrad Hilton said it.
Great. Well, thank you, Mr. Chairman. Just a quick story. A couple of years ago, I was in Rwanda, upcountry, visiting a site, a project of a group called Water for People, based here in the United States, in Denver. It's called La Terre des Mille Collines, the land of 1,000 hills. And I was on top of one of these hills with 12 engineers looking down into the ravine, figuring out where to site a pumping station. I'm not an engineer, but you had 12 engineers up there. You might imagine there were 12 different ideas about where to site this pumping station. That's not the point. The point is that each of these 12 engineers was Rwandan. And each of these 12 engineers was having this vigorous technical debate way over my head in Kinyarwanda, in the local language. The front-end catalytic support provided by the United States, a private nonprofit in this instance, was the secret to that success. We're not out there just drilling wells and poking holes in the ground and digging latrines. We're out there strengthening these organizations' capacity. To answer your question, I'd like to say that are we doing enough? Well, the Water for the World Act that you've sponsored and introduced this morning with Mr. Blumenauer and USAID's new water strategy get it. You get it by asking your question about quality versus quantity. Quality always lags quantity. It's pretty easy, 20 liters per person per day of water, but you get into the quality concerns, particularly in urban environments, particularly when you're dealing with cholera. That's the right question to ask. And the Water for the World Act and the Water for the Poor and the Water for the Poor Act and the water strategy are steps in that direction. The second quick point I'd mention is you asked something about rule of law, about democracy and governance, and water as a means to that end. I want to highlight the work of a group called the Avena Foundation, which is a private philanthropic initiative active throughout the Western Hemisphere in this instance, but strengthening community water boards, community water user associations, building their capacity to manage and solve their own water and wastewater challenges. The work of the Avena Foundation and its many partners is interesting, not simply because they're helping solve water and sanitation challenges in a decentralized fashion. It's interesting because that work is strengthening the social contract in those countries. That work is strengthening the role of women in these water community associations to take charge of their own destiny. I look at every village water committee as a primary school for democracy. And that's something that is also envisioned with the water strategy and the Water for the World Act. This isn't just water and sanitation, but it's water and sanitation as an entry point into the health objectives you're looking for, into the primary education objectives, into the NTD's solution, and so on.
You know, I do have one final suggestion / question. And it would be a takeaway for Mr. Holmes as well. I've been here long enough to know that many a good idea doesn't get passed. I had 30+ significant bills, including 5 veterans bills, die in the Senate. They have very arcane rules. People put holds on things. The International Megan's Law died 3 years ago, which would have been a noticing provision for convicted pedophiles before they travel abroad. And one of those that I got passed was to establish an obstetric fistula repair program and prevention program. Passed in the House, failed in the Senate. I put it into a larger bill. Well, I went to USAID and asked Dr. Ken Hill if he could just take the blueprint and do it administratively. He did. We have now effectuated well over 20,000 obstetric fistula repairs, and the money has grown very significantly. And I'm just wondering, you know, if for some reason, we'll push hard to get this bill passed. If it didn't pass, it could still serve, I would think, as a blueprint. There may be a few authorities that need to be conveyed to USAID, but I think we ought to be thinking, take it, obviously work it, you know, and improve upon it any way you think fit. But it could become the blueprint right now. It doesn't have to wait for enactment. because I've seen it happen many times. The obstetric fistula is just one example of many. Others have had their bills that went nowhere, but they were a good idea, and they all of a sudden the administration said, "Hey, we can do that. We can do it." And I'm just wondering if that's something that you guys have looked at, because I think we should be working to try to get it done, even if the bill runs into a snag somewhere over in the Senate. Notice I said not in the House.
It seems like USAID is already working in that direction, and I want you made a beautiful comment about Chris Holmes, and he's still here. I haven't looked yet back. He's still here. And he's not here because you're here. Chris Holmes will answer his phone, and he wants to know how we get to where we want to go. And it's 6 o'clock at night or 8 o'clock at night. I mean, he will answer his phone. He calls you back. This is very, very important to him. We have never had such a great working relationship with USAID. And I would say the greatest thing that the House might do now is just agree to consent with the Senate bill of $405 million instead of $315.
Thank you, Mr. Chairman. Let me just quickly respond to that. Yes. The Water for the World Act is no marking legislation. We expect this thing to frankly sail through your subcommittee and House Foreign Affairs Committee naturally, send it over to the Senate and see what happens. But a lot of what's in that bill, not a lot I shouldn't say, but some of what's in that bill codifies the progress that the administration is already making on this. Chris Holmes is a great example. The Global Water Coordinator is not in the statute, but the administration, it's a good idea. The administration made it happen. The same with your work with obstetric fistula there. The Water for the World Act, with that said, is very additive in that, in my personal hope, on behalf of the many people who've helped me with this testimony, is that it will increase both the targeting, the pro-poor focus of the administration's efforts to fully implement the Water for the Poor Act. And by that, I personally, as an advocate for pro-poor water and sanitation needs, why not 100% of the funds appropriated under the Water for the Poor Act to the bottom 40 most water and sanitation poor countries in the world? I'm sort of picking numbers out of the air, but is that unreasonable? I don't think it is, or frankly, I wouldn't be good at my job. But secondly, perhaps more transformatively, the effectiveness of this work, the capacity building that we've all talked about here today, the increased monitoring and evaluation and resolution and learning, particularly after the technical end of the project is over, that's what's envisioned in the Water for the World Act. That ribbon-cutting ceremony that we all love so much is not the last stage of the project. That ribbon-cutting ceremony is the first important event in that project. The next most important event is what happens when something breaks 2 years down the line. Echoing what Mr. Morris said here, the answer is not to call USAID, much less the subcommittee chairman. The answer will be found locally, technically, and financially. So I do think it's additive, and I certainly push hard for your support on that.
Well, I'm looking at the Water for, World Act, and I'm looking at my panelist here, sitting next to me here. For Aqua Africa, we're a small organization right now. We have 3 staff members, 2 in the United States, one in South Sudan, trying to advance. So what we need going forward is capacity building. But who do we go to in order to get the support capacity building? And we're looking at now USAID, and in terms of experience, in terms of how much they've accomplished, and looking at my fellow panelists here, that's where we seek the support. And going off of what you said, and what Mr. Morris was saying earlier, we don't want 1-800 hotline calling to USAID trying to solve the problems. We're going to be solving the problems. In order to do that, we need to have the expertise, we need to have the capacity building in place, and this is what it's going to allow us to do. So.
Yeah, like 5 minutes to go, but I'll just say this one quick. I appreciate all your work, and we'll make sure your bill passes. Very technical. I noticed he's wearing his cowboy boots. Thank you.
Thank you, Mr. Chairman.